Welcome back. A new trend on TikTok is asking users to test their biological age through fitness challenges. So Dr. Greg Burzynski with Rester Longevity Clinic is here to explain why we may need to go beyond this trend. Good morning.
Good morning. Thanks for having me.
Yeah, I mean, every day there's something new on TikTok. So let's talk about biological age and how it differs from your actual age.
Sure. So biologic age is how our bodies are functioning, whether poorly or well. So our chronologic age is our birthdays. Every year we're having one, hopefully. Our biologic age is the wear and tear on the cells, on our organs, on our tissues. And that can be changing based on what we're doing or not doing. So for example, we have a 50-year-old male, right? And let's say he has a twin brother. Well, those are the same chronologic age, but biologically, one could look like he's 30, the other could look like he's 75. So clearly there's a lot going on.
So how can you determine your biological age?
Sure. Just by looking at somebody's face, their movement, their energy, we get a lot of information, and we can see at that glance how one could be aging. But of course, we can go much more scientific. We have tests that look at the fitness levels, for example. We can do a VO2 max test. I do this in clinic. I run a patient on a treadmill, put on a mask, and we see how their performance of oxygen to the muscles is. The higher the better, and we can improve on that. That's a great correlate to longevity and also can tell us about our biologic age.
Well, are there some things that you could miss, though, when you're trying to determine it that way?
Of course. So we could look healthy, feel great, but we could be missing, unfortunately, something like cancer. So we know that we should get our screenings, and I encourage everybody to do the age-appropriate ones. But there's just so much more that we should be doing, I feel.
And so there are new tests and screenings that go further, right? And
most definitely. We're living in such exciting times. Let me just tell you about the first screenings that we all agreed upon. There's about a handful of them. The pap smear for young ladies, a mammogram, and then a prostate screen for gentlemen. Then we do a colonoscopy, typically at age 45, younger if we are at high risk. Then, of course, a lung cancer screen if we're a smoker. Now we're living in times where we can have blood tests that can detect cancer at an early stage, 0 or 1. And not just those I mentioned, but the others that we don't screen for. So you don't have to have symptoms to get bad news. You can hopefully catch this much earlier.
Right, and maybe even reverse your biological age?
Ideally, that's where we're going, I hope. Cross our fingers.
And what else do we need to know about this? Because I know a lot of folks are on TikTok and they're trying all these different trends. Is there anything else that they need to know?
Common sense. So ask your doctor, first of all, what you should be doing. This might not be a good idea for you. Get your fundamentals, get your sleep, get your good nutrition, and double check with others, right?
All right. Well, thanks so much for the info.
My pleasure.